Welcome to the Dr. Janine Show. I'm Dr. Janine Bowering, naturopathic doctor, and today we are talking all about mold toxicity. So we'll talk about what mold is, how it affects our health, and also what we can do about it naturally. So make sure you stay tuned for the entire show. Of course, we have my favorite part of the show, which is our trivia section, and we will be giving away a bottle of the VitaTree Vita Detox. This is from our sponsors at VitaTree, so you definitely have the opportunity to win this and to be randomly selected just for attempting to answer the trivia questions. You don't have to get them correct. I just want you to do your best and to try, and it's so much fun. So make sure you're staying tuned for our trivia part of the show. Also for the tips, I'll be going through, the different tips, 9 different tips to really help you if you have been exposed to mold, and maybe you're going to learn more about mold toxicity today, that maybe it's going to be a question that you ask yourself. Maybe you have had some exposure, and it's something that you can definitely work with your own body, doing things naturally with all my tips today to really help you to get healthier, to get your energy back, and maybe some of the other symptoms that you're going through can be related to the mold toxicity. So make sure that you stay tuned for the tips as well. So if you've got questions or comments, please put them in the questions section. Also, make sure that you give me a big thumbs up and all those likes and all those fun presents you can send me. I always appreciate those. Those make the show so much more fun for me as well as we go through. I love to hear your support and your interaction throughout the show. Okay, so let's get started. So mold toxicity, and this is what you need to know. So what is mold? Well, mold is part of the fungal kingdom. So fungus is the overbranching terminology, and molds are different types of fungus, and these certainly can be growing in our homes, then we wouldn't be aware of it. They usually are microscopic, but sometimes they are macroscopic, so you can actually see these things when you know what to look for. And I'm hoping after today's show you're going to see some things that maybe you're just going to do your own due diligence in your own home and in your surroundings, maybe in your office, to make sure that you're not seeing any of these types of mold around you. Now, the World Health Organization has said that over 50% of buildings in North America do have water damage, and we know that, of course, water damage is one of those factors that allow for that mold to grow and creates that perfect environment in that damp, moist condition with lack of proper airflow for that mold to survive and to thrive. And the problem with molds is that it produces different things. So whether that is mycotoxins, which can be very damaging to our body. They're toxins that have negative effects for our health, as well as irritants and also allergens. So people that are having a lot of, symptomatology of allergies, this can very much be related to that mold toxicity. Now, we're going to talk about different types of mold, and this is what I found so interesting. When we just think that maybe there's just one, black mold is something that is very common, and it's often one that's talked about, but there's different types of mold. So we'll first start with Cladosporium, and this can be either gray, it could be brown, it could also be black, and it has a bit of a powdery appearance. So you may have seen this on food, you may have seen this on dead plants and in wood as well, especially if it's in that moist environment. Also in insulation, the Cladosporium can grow, and it is most commonly growing in dark, damp environments, and especially in basements. So this is something definitely to look for in a basement, especially if you have drywall in your basement and maybe there's been, a lot of dampness in the environment, in the climate where you're living, then this is very, very common to have this type of mold. Now, another one that is known as the black mold, which often if you read blogs and things and different information about black mold, it's Stachybotrys, and Stachybotrys atra is black mold, and it can also be dark green, but most times it will be black, and it has a bit more of a slimy sort of appearance. This is commonly found in walls. So also in ceiling tiles as well, and in floorboards. And in any really moist area, this is where the black mold can grow, the Stachybotrys. And unfortunately, it is linked to cancer. So this is why it's so important that if you do have this type of mold in your environment, that those toxins that it can accumulate in the body, especially if your immune system isn't up to par, that it's something that you definitely want to deal with. As well as penicillium. Now this can either be green, it can be white, or it could be blue-like, and it has a bit of that fuzzy appearance. And this can also be found in food, but also in walls and in insulation of your home or your office. And this most often, again, grows in that moist environment and in organic matter as well. Another type of mold is Aspergillus, and this can be gray in color, it can be brown, it can also be yellowish, green, white, or black, and it grows very quickly, commonly found, again, in walls, in insulation, even in soil, and sometimes in clothing. So if clothing sort of, has been sitting in or has been stored in a damp environment and in a humid environment, then this can definitely grow in the fibers of the clothing as well. And it's commonly found in humid, regions like leaky basements or very damp basements that don't have a lot of ventilation and airflow. This is very common, and it does produce a carcinogen called aflatoxin. So again, very much linked to serious diseases, and not everyone always puts those, things together in terms of some of the causative factors as to why people get sick. So that's why I really want to make sure that I'm educating you about these different types of mold today, so that you can learn how to be more proactive about not only, determining if it is part of your environment, but also what you can do naturally in your own body if you've got some of the symptoms, which we'll get to in just a moment, as to, that mold toxicity. Now, another type of mold is called Alternaria, and this is either dark green, it could be gray, black as well, and it has sort of long velvety hairs, so a little bit different in the appearance of this one, and it doesn't need a lot of moisture or water to grow as compared to other molds. And this is commonly found in carpets, which we saw there, in clothing fibers, and often around windows. So if you see sort of the streaky, sort of velvety hairs growing around windows that aren't properly insulated and there's a lot of moisture there, this is one to really look out for. It can also be in damp areas such as the flooded basements. So this is something definitely, if you've had some water damage or a flood, something that is, a big problem. And mold will grow anything from 24 to 48 hours is sort of that peak time. Anything beyond that, if it's not taken care of and ventilated and dried up, then this is when the mold can really set in. So that is your window of opportunity. If you've had a leak in your home, you have to be really careful about that in terms of things being sealed up where you can't see them, that you are doing something to get rid of that mold. Okay, so where do we find mold in the home? So if you're just tuning in today, we're talking about mold toxicity, and here's 9 signs that you have toxic mold in your home. So where does this stuff grow? Well, commonly found in showers. So if you're seeing this around your shower stall, if you visit a hotel or an Airbnb and you're seeing, the mold, this is definitely something that you want to report, because maybe the owners or the, people that are running the hotel aren't aware of it. Maybe they are, but this is definitely in your own home. You want to be on top of this. So shower stalls, as well as in the refrigerator. So doing, some refrigerator deep cleaning at least once a month is a really good idea to make sure that you don't have some of this stuff that is, growing unbeknownst to you. As well as in basements. So if you definitely have that dry, moist environment in basements, whether you've had a leak or not, if it's an older home, then often this is hidden and can be hidden behind drywall if it's a finished basement. But even, in an unfinished basement, this is very common. As well as drywall. So this is another, common place, whether you've had water damage or not. Certain climates definitely are more prone, because of the moisture and the rainfall, to having mold issues in homes. Now, number 5 on the list list is carpet. So here is another common, you've had your carpets maybe cleaned and maybe that water wasn't sucked up enough from the carpet cleaning itself, or if there have been a lot of spills or with pets and things, if it's not properly dried and there's not a lot of ventilation, this is a common place for mold. So you want to look underneath the carpet as well. So not just on the surface of the carpet, but often if you lift up that carpet and look underneath, this is where you may see some of that mold toxicity. And you want to be really careful. I mean, you should be masked and, have full protection, because this can be very damaging to your health. And if you start to disrupt the mold, then this is, another causative factor for some of those health problems that definitely you want to be aware of as well. Also in furniture. So if you go to the thrift, and you buy the thrift furniture, or furniture has been passed down to you, just be very aware, even in your own home, that there could be mold spores in the furniture as well. Also in wallpaper. So wallpaper, and I would think, more in an older home, but here we can see, it's a pretty bad case of that mold that would be hidden. You wouldn't necessarily know that it's there until you expose it by lifting up that wallpaper. So be really aware of that. And of course under sinks. So whether this is in the kitchen sink, this is in the bathroom sinks, a common place for that mold growth. So making sure that you have properly fitted sinks and your plumbing is up to speed in terms of that proper drainage, and that everything is sealed up nicely is very important, especially if you're purchasing a new home. This is something that definitely a home inspector is going to be looking for and to make you aware. So make sure that you are doing your due diligence. And number 9 on the list is food sources. So whether that is, now these are, you wouldn't necessarily think about this, but in wheat, so in grains, this is commonly found. Also chocolate, unfortunately, can be a source of mold. So you definitely want to make sure that if that chocolate, you start to see that whiteness happening on the chocolate, then that is not a good sign. You definitely don't want to consume that. As well as in coffee. So coffee can also and be a place for that mold growth, as well as in fruit juices. So if a fruit juice has been sitting too long, then that would be another source. Also in milk and dairy products. So this is commonly, again, if it has been a little bit too long past that expiry date, then this would be a common place to have that mold exposure as well. Also in vegetable oils. So this is another thing that most people wouldn't be aware of. Also ethanol would be another source. Also beer, unfortunately, can be a source for mold exposure. And even herbal teas. So herbal teas are commonly known as a source. Also some nuts and seeds would be another source of mold, and something called aflatoxin, which is commonly found in peanuts and cashews. So something, again, to be aware of. You definitely, if you are eating and consuming nuts, you want to buy them fresh and make sure that you're consuming them quickly and keeping them well stored, because of that potential of that mold toxicity. So if you're just tuning in today, thank you for tuning in. I'm Dr. Janine Bowering, naturopathic doctor. We are talking all about mold toxicity today. So hello on YouTube, on Facebook, on Instagram Live. Nice to see you, and all my TikTok followers as well. Remember to stay on the line after the show, because on Instagram Live and on TikTok, we will be answering some more questions, and I am here for you. So make sure even after the show finishes that you stick around, and I will be able to engage with you then. Hello on YouTube. Freddie is here from Portland, Oregon. Nice to see you. And Thomas is here on YouTube as well. Thank you for tuning in today. Nice to have you here. So I hope that you're learning something new. If you do have questions throughout the show, please make sure to put them in the comments section. Okay, so continuing now with mold toxicity and some of the outdoor sources of mold. So again, we would think you go outside. So certainly it is much better for people, and people who do have mold toxicity, they often feel much better when they are in the outdoors. But just some areas to be aware of. So in the fall, when the leaves are decomposing, that can be another source of that mold toxicity. So if you are super sensitive, you may notice that this is a problem. Also dead trees. So if you're out in the forest, or if you have dead trees on your property, this can be a common source of that mold exposure. And in composting. So if you do your composting, this would be another source of that mold exposure, especially if you're super sensitive to it. Okay, so now we're going to talk a little bit about the symptoms of mold toxicity. So these are signs and symptoms that your body is telling you, perhaps that you have some toxicity that your body simply is not dealing well with. And of course, we always have mold exposure. It's not something that, I would say it's possible to always, go through life and never have that toxicity or that exposure to that mold, but your body knows what to do with it. So here's why, some of the things that you wouldn't necessarily expect in terms of symptoms of mold toxicity is that, and I've experienced this with my own patients in my practice over the years, is that a patient can look generally pretty healthy. And the thing is, though, often that patient has been to multiple doctors and, maybe not getting the help that they've been able to, actually find why they're feeling off a little bit. They don't necessarily have to have overt symptoms in terms of, or, anything coming up in their lab work. The lab work and routine lab works aren't really showing anything in terms of their symptomatology, but they just don't feel right for whatever reason. And sometimes, patients that do have this mold toxicity may be on multiple medications or they've tried different, routines and regimens from their practitioners, and nothing really is getting at, them feeling better, and there's no real solution. So it can be very vague in terms of symptomatology, which when I get to the symptoms, you can see how it could be related to other things, but not necessarily, being able to pinpoint, and the doctor is not being able to pinpoint exactly what's going on in terms of, that diagnosis of mold toxicity. So something to be aware of. Okay, so let's talk now about some of the main symptoms of mold toxicity. So the first one is definitely allergic reactions. So you could have sinus congestion, a lot of sneezing, and runny nose. That could be a telltale sign of that mold that you have been exposed to and your body's actually reacting to and mounting that response, as well as a chronic cough. Even sore throat can be related to that mold toxicity in the body. Chronic red eyes. So this is common in so many people, and they don't know that it's actually related to that mold toxicity. Also blurred vision, which can be related to mold as well. And rashes on the skin. So again, when your body's reacting to something, it often is going to give you some telltale symptoms. You may not know that it's the mold, but you could be getting skin rashes because of that mold toxicity. Also breathing difficulties, asthma, and having that spasming in your bronchioles and not being able to catch your breath, so shortness of breath, can be related in the lungs as well to that mold toxicity. Hello, I want to say a few more hellos on YouTube. So hello to Marie, nice to see you, MM. And question from MM, do allergy shots work against mold toxins? Well, it really depends on the person. So sometimes yes, and I would say sometimes no, because if you're not really addressing the root cause as to why, your immune system isn't being able to react to that mold toxicity, which I'm going to get to when we get to the tips in just a moment, that could be, why there is, not your immune system isn't having that proper reaction. So yes, if the allergy shots help to trigger your immunity to do what it needs to do, but I would say often there's some more foundational and, things that are lacking in terms of when I get to the tips I'll share that, may be missed in terms of why your body's not reacting in the proper way. So stay tuned. I'm going to get to, it'll make more sense when I get to the tips today as to, why we want to trigger the immune system in the right way. Okay, so let's continue with some more symptoms of mold toxicity. So in terms of brain function, you could have headaches. So yes, so here's an interesting thing. I want you to pay attention to when you have and where you get your headaches. Do they happen at home? Do they happen when you're outside? Or do they happen more at work? I mean, depending where your environment is, perhaps, and potentially is just something to think about in terms of your mold toxicity. If you have more mold toxins at home and you're getting the headaches at home more often, then that could be one of the reasons. So it's just something to think about. As well as light sensitivity can be related to this, and that can often go along with the headaches if you do suffer with migraines. This can be related to mold toxicity as well. Also, poor memory can also be related to this, and difficulty sort of getting and finding the words in your sentence, what you need to say next, can be related to mold toxicity. Also difficulty in concentration and vertigo. So that dizziness can be related to mold toxicity and exposure as well. And next, when we talk about some symptoms, this can be in the muscles and joints as well. So if you experience, a lot of fatigue and weakness, morning stiffness, you wake up and you have joint pain, that can be related to mold toxicity in your home, of course. And unusual skin sensations. So tingling and numbness on the skin, which can be related to the nerves as well, can be some of the symptoms of mold toxicity. So something to definitely look into and check with your practitioner. Some other symptoms can include digestive issues. So whether that is in terms of the kidneys, it could be, uncomfortable feelings. It could be diarrhea, constipation, gas, heartburn types of even overt pain and bloating in the abdomen, and also in terms of urination, an increase in urination, and I'll explain that in just a moment as to how that is related. Also, appetite reactions, so you may have a bit of a metallic taste in the mouth, and that is related to heavy metals as it's related to mold toxicity, which again I'll explain in a moment. Also, swings in your appetite, and a lot of sugar cravings is definitely related to mold toxicity. And of course, an increase in thirst. So if you have a lot of, you're thirsty all the time, this can be related to mold toxicity, which is a great segue. I am not overly thirsty, so I just need to have a sip of water. Also, difficulty in regulating your body temperature can also be related to mold toxicity. Also, if you experience a lot of electrostatic shocks in your home, and I'll explain this in a moment, how this is related to your MSH, and also frequent infections can be related to mold toxicity, and multiple chemical sensitivities. So if you're that person that just reacts to everything, this is definitely and can be related to what's going on with your health. So here we go, talking about, your different reactions will vary based on several factors happening in your body. So some people will have a lot of these symptoms, other people will have less of symptomatology when we're talking about that mold toxicity. So it really does depend on the type of toxin that you're exposed to, what types of mycotoxins that your body is actually producing, in terms of how much exposure you've had and how you've been exposed. Was it inhaled? Then of course you may have more lung types of symptoms. Was it, skin exposure? Or if you're just around and have constant exposure all the time, then certainly this is going to vary how your reactions will be in terms of how, poorly your body is doing in terms of that mold toxicity. Also, your genetics have a lot to do with this as well. So for people that are familiar with the MTHFR, there's also something called an HLA-DR. So 25% of the population have this genetic mutation, which is the HLA-DR, and this means that your immune system isn't going to be able to learn to defend itself very well from that mold exposure. And this is something that can definitely be tested in genetic testing to see if you you are, one of these people that's even more sensitive, especially to the mycotoxins that will just continue to build up in your body and can escalate these issues of the mold toxicity in terms of your overall health. Also, your age will vary in terms of your symptomatology, also your nutritional status. So if you are that person that's addicted to sweets and maybe, in terms of your immune function is compromised as well, then you're definitely more at risk for this mold toxicity and its symptoms. Also, if you have underlying infections like chronic candida and yeast issues will definitely put you at more risk. And also if you have these biofilms, which is very common with, candida and chronic candida issues, which is something that I talk about in other episodes. When your microbiome is out of balance, that's something that I talk about in my other YouTube videos. So make sure that you check those out. Also, leptin resistance is actually related to this whole mold toxicity issue as well, which I will explain in just a moment. So continuing now, if you're just tuning in, I'm Dr. Janine. Today we're talking about mold toxicity, we're talking about symptoms, and some of the treatments. So I'm going to get into the tips as to what you can do if you do have mold toxicity. Definitely something to check with your practitioner and have this properly evaluated, and ways to prevent this as well. If you're just tuning in, we are on YouTube today, on Instagram, on Facebook, and on TikTok as well. So hello to everybody who's tuning in. Hello, Melbert. I know that you're here. Thank you for tuning in. JJH, thank you for tuning in today on TikTok. I know a lot of you are here, so thank you for tuning in. Don't forget, we have our trivia section coming up, so make sure you're staying tuned. That's always so much fun. Hello to Renika and JC on YouTube, and also Kathy on Facebook. Thank you for tuning in. It's great to have you all here. Okay, so here we are now going to talk about the link between mold and EMFs. So you've heard me probably, if you've followed me for a little while, you know that I have talked a lot about EMF exposure. And there's different types of EMFs, of course, which is electromagnetic fields, and I'm talking about the non-native ones, so the ones that are not naturally occurring in terms of our exposure here on Earth. I'm talking about non-ionizing radiation, so whether that's from anything that's plugged in, so whether that's our appliances in our homes, our home wiring system, of course our Wi-Fi, and our computers, all of our devices. That's why I always say put your devices on airplane mode. I have a whole show all about EMF exposure, so please check that out, because I give you a lot of tips as to how to decrease your risk to that EMF exposure, practical tips that you can use in your home to really decrease your exposure to the EMFs, because we know that mold thrives when we have more EMF exposure. And this is something that Dr. Dietrich Klinghardt was and reported on experiments that were done by a Swiss doctor, in which they did an experiment. So they were growing mold and in petri dishes, and what the doctor did was covered up, so protected one growth plate of the mold with Faraday fabric. So if you don't know what that is, it's a fabric that's finely mesh woven. Usually it's silver. It can be, other metals that will not allow for that EMF to penetrate through the fabric. So what they did then was they exposed the plates to that EMF exposure, and they found that the unprotected mold plate had 600 times more growth of the biotoxins, those mycotoxins, as compared to the one that was shielded by the Faraday fabric from that EMF exposure. So they also found that, that mold that was bombarded with the EMFs became more invasive, and it actually made it multiply to actually defend itself from all of that EMF exposure. So this is something that I really want you to think about, because as much as, we know that EMFs have negative impacts on our cells, it opens up our VGCCs, which I've talked about in other posts, and if you don't know what that is, that's, too much calcium will flood into the cells and really damage our mitochondrial health. So this is something that you really have to, in terms of your mitochondria, if you want to be healthy, body. You've got to fix what's going on with your something called your redox potentials. This is what gives you life, gives you energy. And when I get to the tips, you'll appreciate why it's so important in terms of mold exposure. It's one thing to be exposed, but if your body can't deal with it, and this is what we're talking about, why people get so sick from mold exposure, it oftentimes is because of what's going on in our environment. So fixing that EMF, equation, what's going on for you, is something that I really want you to think about, because it is really, really important, and it only gets worse and worse with 5G, and now 6G and 7G is going to be on the forefront, that we do everything in our power to really protect ourselves. And back to Dr. Klinghardt, he actually pointed out that, and this is going back at least 10 years, that cell phone radiation in just 1 cubic inch of air is now 1 million times higher than what it was 10 years previous. And this is actually a dated, quote from Dr. Klinghardt going back at least 10 years. So what would it be now with 5G? I mean, would it be 10 million, 20 million? Who knows? So just to think about, that exposure, and definitely the links have been made that Dr. Klinghardt, has helped a lot of women actually because of the links to autism with this whole combination of the EMF exposure. But also he found that if a woman had, chronic yeast issues or even Lyme disease before or during pregnancy, combined with that non-native EMF exposure, it really, really increased the risks of autism and, having not so favorable outcomes for having a healthy baby. So something definitely to think about, especially if you're wanting to conceive or in those times of, pregnancy, to really do your best to limit that EMF exposure especially. Okay, continuing with mold and the human body. So today we're talking about mold toxicity. So molds actually incorporate heavy metals, so things like mercury, to protect against the white blood cells. So this is why heavy metal toxicity compounded with having mold exposure can be very detrimental to your health. And this is why it's so important, because white blood cells are actually killed by the mercury, but the mold isn't. So the mold will allow to propagate in the system. And this is where something that's interesting in making those connections that I told you about leptin. So MSH, which is melanocyte stimulating hormone, is a hypothalamic peptide. It also is in the pituitary, it's also in the skin, that is involved in cytokine release. And this is, of course, part of our immunity. We don't want that cytokine storm to be overly aggressive, because we can run, you've heard about this in the news probably, with certain viral infections, you don't want this to be over-inflammatory. But low levels of the MSH are associated with mold toxicity, and this is where one of those less favorable bacteria can really grab hold, which is Staphylococcus, and also EMF exposure and Lyme disease has found this correlation with low MSH. Now, low MSH is also related to low melatonin, also decreased endorphins, so this is why people with low MSH can have chronic pain issues, and also leaky gut syndrome is known to damage the gut. Now, when we come back to the Staphylococcus infection, so remember, low MSH causes more of a staph infection that is related to biofilms, and the biofilms are related to chronic candida issues, which further decreases and depletes your MSH, and now you get more leaky gut. So you can see how this is a vicious cycle of not being healthy because of what's gone on because of that low MSH. Now, what helps to increase your MSH? Natural sunlight exposure. So when I get to my tips, this is going to make more sense to you. Also, low MSH, unfortunately will decrease your ADH, and this is related to your kidneys, which can make you more thirsty. So for that person who's chronically thirsty all the time and has increased urination, also that low MSH is related to electrical shock. So remember earlier when I said that if you're really prone to, touching things and you get static shocks all the time, it's not always just the environment what's happening. It's because of your own biochemistry and what's happening with you internally, electrically, and with that low MSH, you may be more prone to getting those shocks. So again, something that can be related to that mold exposure and that mold toxicity as well. So I hope that's something that's new that you learned. All of these things are, to me, when they come together and they make so much sense, it just makes so much sense. And people would necessarily relate, static shocks with having mold toxicity. So that's why it's so important to share this information. Please share my videos and my content with someone who will definitely benefit from, this information, which is, to me, so fascinating. Okay, so now let's get to the tips. How do we remove the toxic mold? Well, definitely in your home, you definitely want to fix any leaks and other water problems and plumbing problems. Definitely get these things fixed, as well as scrubbing the mold off of, if it is visible in those hard surfaces, using the proper detergent and water. You never, ever, ever want to use bleach, because bleach will actually make that mold propagate and flourish and, disrupt that mold in a negative way. So please do not use bleach. If you see any type of, you're reading something online and you're seeing references to using bleach, then that is the wrong information. There are specifically formulated formulations, some of which are more natural, that you can definitely look out for that will help to deal with the mold. Now, definitely you want to seek out, if this is a really, infestation of that mold, you definitely want to seek out professional help, because the mold experts will know exactly what to do. Often you're going to have to move out of, if you have a really bad problem, you're going to have to move out of your home so it can be dealt with properly, because those mold spores will become disrupted and will get out into the environment, and that's something that you have to be very cautious of. Also, you have to make sure that you are drying up that environment very, very well, and increasing ventilation is very important as well. If there's proper air circulation, then that mold will not be able to grow. Also, mold grows in different layers. So as much as you think that you're cleaning off the surface and you don't see it on the surface, usually mold will bore into the surfaces like particle board and drywall, that you can't see it beneath the surface, and those roots can be embedded in that. What you see on the surface, it has roots, it goes down much deeper. So the spray, if you're just spraying on the surface, it's not necessarily going to reach those deeper layers. And also, even the dead mold, so if you think that you've killed it, it's still allergenic and still can cause those symptoms for your health. So you really have to do this in a proper way and call the experts in the best way possible, and make sure that you research a good company that knows and has the experience as to how to do this properly. Okay, so here we get to the 9 tips to prevent mold toxicity. So tip number 1 is to stop the exposure in the first place. And if it is there and it needs to be removed, make sure that you are having it safely removed, calling in the professionals to do it in the right way, and to make sure that you're minimizing your risk. Tip number 2 is to use air purifiers. So, getting it out of the ambient air is very important for your overall health, and making sure that you're able to do that with a good quality air purifier. Tip number 3 is to definitely get outside. So limiting your EMF exposure is the most important thing that you can do. So this is nature's prescription. So getting outside, getting away from EMF exposure, doing your grounding first thing in the morning is really important. So bare feet on the beach like this would be awesome if you can, but also out on the grass, out on the ground, and doing that every morning, looking at that early morning sunlight and getting sunlight exposure, especially in the earlier hours of the day, is really important for your redox potentials, which I mentioned earlier, helping with your mitochondrial health, and to really make sure that your body can defend itself in the event that there is some mold toxicity in the environment. Tip number 4 is to use an infrared sauna. So this is something that, I often do myself as a great way for detoxification, but to ensure that you're able to, get at that sweating. So you want to have that increased perspiration, which helps to relieve that heavy metal toxicity, which can be stored in your cells. It does come out in the sweat, and this has been studied by numerous, researchers that have looked at that detoxification aspect of using the infrared sauna. So that's definitely something to do. Tip number 5 is to use some essential oils. So these will not necessarily get rid of it, but if you are able to diffuse some of these in the air, it will inhibit the growth of that mold in your environment. So some of the great ones are cinnamon, also thyme is fantastic, clove oil, and also tea tree oil. If you're using these in a diffuser, can be a great way to ensure that you are, decreasing your likelihood of that mold growing in that environment. Okay, tip number 6 is to use salt baths, and you can use Epsom salts. You can also use a multi-salt, like sea salts are very healing. Also adding some herbs in here, things like cilantro, as well as chlorella, and a mixture of herbal medicines that are known to actually help with that detox process. You can actually open up into your bath and be able to sort of draw those toxins out through your skin. Usually in a bath, though, you need to soak for at least 30 minutes or so. I say even longer, 40 minutes is better, to allow for that drawing of those toxins out of the body. Tip number 7 is to do a full body detox. So this is important in terms of, especially including that heavy metal aspect of detoxification, which is important because the fungus, as we talked about, thrives on those heavy metals, especially mercury. So eliminating that in a healthy way, in doing a full body detox, also addressing your other organs is really important. That's one of the reasons that I also love chlorella. So chlorella, as part of a full body detox with other herbal medicines, is a great way to trap and, not only the mercury, but things like aluminum and other heavy metals, but also helps to detoxify specifically the mycotoxins associated with that mold exposure. So we'll put a link below to a great full body detox that you can, do some further investigation on to help with that full body detox for you. Tip number 8 is to do parasite and candida cleansing. So we know that if you're prone to having chronic yeast issues and maybe some less favorable organisms in your microbiome, in your digestive tract, it's important not only to do a kill phase with some of my favorite herbal medicines, which are great, so we'll share links below to this as well. So things like oregano are fantastic, black walnut are great at killing off those less favorable organisms, but you also have to put the good things back. So things like your probiotics, of course, and also using digestive enzymes, which can also weaken the walls of, the candida and those less favorable organisms, so that those herbs like the oregano and, artemisia and all of these things can go in and do its kill job so much more effectively. And tip number 9 is to ensure that you're taking care of your nutrient deficiencies. So one of the things that's really important is magnesium. The reason I love magnesium is because it's a natural calcium channel blocker, and this is really important for the EMF exposure, so really helping to mitigate too much of that calcium getting into your cells. But most people are actually deficient in magnesium simply because we don't get enough of it in our diets, and that's why supplementation is really important. It also helps to, when you're taking a bisglycinate of magnesium, helps to repair the leaky gut, which we know can be compromised with mold exposure as well. So that's something that's very important, as well as a whole food vitamin C. So of course increasing your vitamin C in your diet from whole food sources, but also if you need to go to a whole food multivitamin or a whole food vitamin that contains, things like amla berries, acerola cherries, camu berries are fantastic because it's a natural whole food source of that vitamin C, which is very protective. And also using a functional protein powder, so getting enough of that nutrient density from a good high quality protein, but also cofactors like selenium are very important, and acetylcysteine. These are really protective, help our glutathione levels, which are really important for that mold exposure as well. and keeping you healthy. So there you have it. So those were the 9 tips to help to prevent mold toxicity. And it was, I want you to really start to incorporate these things into your daily diet and your daily routine, fixing up your environment so that, if you do have that mold toxicity as an issue for you, that you will have this investigated, but also making sure that you're cleaning up that environment. So if you're just tuning in, I'm Dr. Janine. Today I'm talking about mold toxicity, symptoms, treatment, and prevention. Hello on YouTube, Facebook, Instagram, and TikTok. Of course, make sure you stay on the line on TikTok and on Instagram because I will be answering your questions. Okay. So we are getting to the fun part of the show. I will be asking my quiz questions now. So get ready, do your best, even just for participating. We do document everybody who participates in the quiz section of the show, and you have the ability to win this. So this is from our friends at VitaTree, the Vita Detox. So when we talk about full body detox. So good luck, everybody. Here we go. Question number 1. And I need to see all my answers here. Thank you so much. Okay, are we ready? Hello, hello, hello. Okay, let's go. Question number 1. What toxic filler found in supplements was banned in France in 2020 and now is being phased out of all of Europe? Does anybody know? Let's see who's quick today. Wait, I can't. Melbourne? Yeah. Melbourne's got it? TikTok has it. Wow. Mud the Weenie. Hello, Mud the Weenie. You're here as well. You guys, ladies are quick. Instagram has it as well? Wow. Aisha. That's my girl. Good job. That's on Facebook. Sparkly Wahlberg has it as well. Nice to see you. Hello, Killing COVID Time. Thank you for tuning in. User 234, good job, good job. On TikTok. TikTok's very quick today. Instagram as well. Nadia and what? Engmark22 has it. Okay, so anybody else? Last attempt. So the toxic filler found in supplements that was banned in France in 2020, and now the entire Europe is banning it, phasing it out over the next couple of years, is titanium dioxide. So make sure that you are looking for that. If you are taking supplements, make sure that that is not in the ingredients. This is sometimes found in cosmetics and also sunscreen as well. So make sure that you are not exposed to that and you're not ingesting that in your vitamins. Okay, good job everyone. Question number 2, are we ready? Steve Backup had it as well. Okay, good. Question number 2, what is a similar filler found in supplements to the titanium dioxide and can also have nanoparticles? So this one is similar and still found in most supplements and is very similar to the titanium dioxide. Sparkly Wahlberg has it already? That was on Instagram, right? Ah, good job. Anybody else? Hello, hello. Hi, Francis is here as well. Nice to see you. Engmark22 has it as well. Instagram is taking the lead today, I think. Instagram's very quick. Anybody else on TikTok? What is it? Shine? Shine. Nice name on Instagram. Instagram's very quick today. Hello, hello. Red Roses, nice to see you. Hello. Thank you for tuning in. We're in the quiz part of the show right now. So do your best to answer the questions. Nadia also has it on Instagram. Instagram's killing it today. Good job. Anybody else? Thank you, Francis. Any other TikTok? No? Okay, so the answer is similar to titanium dioxide is silicon dioxide. So please look for silicon dioxide if it is in your supplements. This is something that definitely should not be consumed, in my opinion. It is in a lot of supplements. You would be surprised. So please look out for this in your supplements. Okay, question number 3. What is the name of the flow agent that is sometimes labeled as vegetable stearic acid? Again, found in supplements and vitamins. What is the name of the flow agent that is sometimes labeled as vegetable stearic acid? Oh, Francis, yes. Yes, you're right. Thanks for noticing. Oh my goodness. Anybody else have? Praising Lady has it, and Sparkly Wahlberg has it. Yep. Ah, Killing COVID Time. Good job. Good job. Eng22 has it. Yeah. Good job, everyone. Everybody, Instagram is very alive and awake today. Mother Weenie has it as well. Oh, yes. Yes, 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 yes. User 234, good job on TikTok. Nadia on Instagram has it as well. Okay, so the answer is, anybody, last ditch attempt? Anybody? So that flow agent that I'm very much against is magnesium stearate. So please, again, look for this on your supplements. It's something that I talked about last week. Again, I draw my questions usually from the previous episode of the Dr. Janine Show, so that's a way to sort of, know where I'm coming from usually. I might throw some curveballs out there in the next few weeks, but yeah, usually that's where I get my questions from. So this was last week's show all about the fillers and flow agents. So if you missed that show, please check it out on YouTube, because it's really important that you know and what to look for if you are taking vitamins and supplements. These are the things to avoid. Okay, question number 4, true or false? This is too easy. Okay. You can buy supplements without toxic fillers and flow agents. True or false? You can buy supplements without toxic fillers and flow agents. Everybody's going to be quick on this one, I hope. Arletta, good job. You had it correct on Facebook, the previous question. Good job, good job. Aisha, good job. Sparkly Wahlberg, Praising Lady, Mud the Weenie, Melbird, Steve Backup, Kate Traber, Dowd. Oh, Praising Lady gave us what brand? I like Praising Lady. Good job. Melbird, woo, Melbird too. Good job, everyone. Hello. Erica, thank you for tuning in. We are just in the quiz section of the show right now. So do your best. And okay, so yes, that was definitely true. Yeah, Arletta, you had it as well. Good job. On Facebook. So yes, so true. You can buy supplements without toxic fillers and flow agents. This is something you definitely want to be looking for. I mean, certainly you're taking supplements to feel better. You want to, have good health. And these things are hidden, so you definitely have to read your labels, but also search out, the best vitamins that will definitely not contain these fillers and flow agents. So always doing your research on this. Mud the Weenie, good job. Okay, let's go on to our last question. I don't know if you'll get this one. Yeah, I think you will. Question number 5. What additive in vitamins has been linked to hyperactivity in children? Something, again, that I talked about last week in the show. What additive in vitamins that's commonly found in vitamins and supplements has been linked to hyperactivity in children? I'll take a few answers here. So let's see if anybody was remembering. Hello, Melbird. Wow, good job, Melbird. Beautiful Nature, thank you for joining. We're just in our last question of the show, of the Dr. Janine Show. Yes, user 234, good job. Yes, possibly yes. Sparkly Wahlberg, good job. Arletta, good job. Anybody else? Kate Traber, good job. Mud the Weenie, yep. Francis, that was for one of the previous questions, perhaps. Anybody else? What is commonly found in vitamins that has been linked to hyperactivity in children? This was Dr. Feingold that discovered and did some studies and analysis back in the 70s on this. And a lot of pediatricians, you know, whether they're in the natural realm or I wish it happened more often than not when, you know, speaking to parents in terms of their education and what they had been suggested for their children in mainstream medicine for ADD and ADHD. I didn't hear this as much as I would have liked to based on the research that I thought, you know, most practitioners would have known this, but definitely that strong link between these things and for hyperactivity for kids. So, okay, anybody else? Francis, you're lagging, that's funny. Aisha, good job. Yep, on Facebook, I see it. Harvarinder, nice to see you. Thank you for tuning in on YouTube. And Marie, hello, hello. Maria. Okay, yeah, you've been struggling a little bit. So yeah, please don't hesitate to reach out to the team and email if you do have some questions. Okay, thank you for tuning in today. Okay, so the additives that I was looking for was food dyes and preservatives. So whether that's potassium sorbate was evaluated, and some other preservatives, formaldehyde as well. So good job, everyone. Everybody, you know, is definitely on top of things today, and thank you for tuning in. So make sure you're staying tuned in on Instagram and on TikTok. I'm just going to wrap up the show here for everybody else, and I will get to your questions in just a moment. So thank you, everybody, for tuning in today. I am Dr. Janine. That was the Dr. Janine Show. I'm sure you're going to have more questions and comments. We talked all about mold toxicity today, so please be sure to leave it in the comment section, and also be sure to share this video. You know, it's really important for other people to know about what they can do for their own health naturally, and maybe somebody you know isn't feeling well. It could be related to mold toxicity and everything that we talked about today, so please be sure to share this video. I also appreciate a big thumbs up and all the likes and the love that you can send me. It's truly appreciated from the bottom of my heart. And also make sure, if you're new here, that you're subscribed. Also click that bell to turn on your notifications so you always get notified of my newest and my latest uploads, which happens every single day of the week. And remember to always take good care of your health and to do it naturally. Thanks for watching today.